Gentleman from Louisiana, Mr. Scalise.
Thank you, Madam Chair. The bill before us, H.R. 3200, constitutes a massive government takeover of our health care delivery system, leading to rationing of health care for Americans, hundreds of billions of dollars, and new taxes on the backs of American families and small businesses, and will lead to government bureaucrats interfering in the relationship between patients and their doctors. At a time when politicians and bureaucrats here in Washington are exerting unprecedented level of government intrusion into the everyday lives of our society, the secretive way which this bill was drafted with hearings closed to the public is an insult and a disservice to the American people who expect and deserve transparency from Speaker Pelosi and the Democrats running Congress. Just this morning, the CBO's director testified that this government takeover of health care will increase federal spending significantly without the corresponding savings that were promised. If the past 7 months have proved anything, it's that this liberal agenda is profoundly removed from the ideals of the American people and the ideals that our country was founded upon. From the so-called stimulus that puts $787 billion in debt onto the backs of our children and grandchildren and has led to our unemployment rate approaching double digits, to the cap-and-trade energy tax, which will impose over $1,300 in higher utility bills on American families while running millions of jobs overseas. The liberals running this Congress have proven to be completely out of touch. No one disputes that our health care system needs reform. We need to make health care more affordable. We need to improve access to quality health care. We should place more emphasis on primary and preventive care. And we need to bring health care costs down by ending frivolous lawsuits and rooting out waste, fraud, and abuse in the system. But you don't destroy all the things that work in order to fix the problems that exist. This bill will result in the rationing of critical life-saving medicine to our nation's seniors and will result in millions of people losing their current health plans and billions in new taxes at a time when our economy can least afford it. This bill represents a war on the middle class. On a number of occasions, President Obama has said if you like the health care plan you can keep it. But in Section 102 of his bill, right here, they allow the government health care czar in Washington the ability to kick you out of your plan if he determines it to be out of compliance with new national mandates. If President Obama truly stood behind his pledge to the American people on health, he would oppose this bill. President Obama also pledged not to raise taxes on anyone making under $250,000. In Section 401 of the bill, right here they impose new taxes on American people, including $29 billion in taxes on the uninsured. If President Obama truly stood behind his tax pledge, he would oppose this bill. Clearly, there are big problems with this bill. It will result in millions of people losing their current health insurance. It will ration health care to our most vulnerable populations while imposing more than $800 billion in new taxes and penalties on American families. And the health care czar will be able to ration care and take away your plan even if you like it. The president's now running banks. He's running car companies. And his stimulus bills cause 2 million more Americans to lose their jobs. Considering how poor of a job the federal government is doing at running private companies and managing the economies, imagine what American health care will look like if the federal government takes over the health care system. I yield back.
Gentleman's time's expired.